The key thing for healthcare professionals is to listen to the story, to listen to what the patient is saying.
I think it's listening to mothers or listening to people and just keeping in the back of your mind that it could be something else.
Listen to your patients. They know their own bodies. They know what doesn't feel right for them. That is just probably the most powerful thing. Just listen and act upon it.
Your response can make a huge difference to a person's life.
Often patients will say that they felt something was wrong. We tended to see patients after the fact, but often the stories that they give are of typical symptoms that we are used to hearing in terms of heart disease and heart attacks.
Treat the person, not the pathways of the symptoms, because we don't express them.
And always remember that for a patient to pop to hospital and get a troponin checked, if you're worried about this as a possible diagnosis, it's a very sensitive blood test. If it's normal, there's a very quick answer to the question that you can get for patients.
Don't be afraid to do those extra tests, just to check their troponin levels, to an ECG.
Just not to assume as well that it may be drug related or kind of anything to do with that, because there are other reasons why people who are young may have a cardiac incident.
Particularly for the P-SCAD, being detached from a baby for a week is horrendously difficult, aside from what you're going through in your own recovery. So it's really important to think about that aspect of motherhood, and not just someone who's had a heart attack and is dealing with a coronary problem. I never knew anybody like me had a heart attack. That's why I didn't believe or trust in anything. So I think more needs to be done in helping people understand that actually it does occur.